All right, everybody, welcome back to the Barbell Therapy Podcast. I'm your host, Dr. Brett Scott. With me here today is Lauren Decretico. Lauren is my business coach. She's a sports psychologist, kind of. And we'll get into that later because she's going to come back on for another episode soon. And today she's actually going to interview me about some of my thoughts on healthcare and some things that I think about and trying to promote for patients, people that just want to learn more about what healthcare is, how it works, how it sucks, things like that. And before we begin, I just want to announce we do have our podcast now sponsored by Ascent Protein. Ascent is one of the best proteins I've found that has whey proteins, vegan plant-based proteins, creatine sourced by CreaPure, which is the best type of creatine you should be consuming because it's the most pure and has no additives or substrates in it. And if you would like some, come into the shop and pick some up at Architect Fitness or Barbell Therapy. So, Lauren, thanks for coming on. Let's take it away here.
Let's get into it. Hey, Brett. So let's just get started with, I know kind of how you started your business. Maybe you can share that if people don't know, but I really want to focus more on not so much why you started the business, but what's your why now? What's your why for this podcast and just sharing like this health optimization stuff?
Yeah, so I think for me, the reason I got into business was definitely a little bit different. But the reason I am here today still doing what I'm doing is I've just seen a lot over the years with my own health. And the reason we practice the way we practice, the reason I have the podcast is really because I think there's just better things out there that people don't know about. And I have been failed by the traditional medical model multiple times. So I was misdiagnosed with an autoimmune disorder 3 times and told by doctors I was fine, I was overtraining, when really I had ankylosing spondylitis the whole time. And it wasn't until I went into a cash-based osteopathic practitioner that I started to get answers and started to realize that it just wasn't about medication, but about supplementation and nutrition and lifestyle changes and habits and behaviors that would improve my quality of life long-term to manage this disease. And then about 5 years ago, I started having all kinds of, we'll just call it IBS symptoms. And I had gone to my primary care multiple times. They told me I was just stressed. They referred me to a dermatologist for some like skin issues I was having. And they just gave me a steroid cream to cut down the inflammation, but that never was the root of it. And then it wasn't until I went to a functional medicine doctor that I was able to find answers in that it wasn't just that I was stressed and that I had a parasite that had been living with me for multiple years now. And on top of that, my gut was in complete severe dysbiosis. So all of the bacterial profile and everything was completely off. And so a lot of that can be said in that if I just went the traditional healthcare route and took what the doctor said, I would still be here today suffering. Which, because I knew there was something else out there, I was able to take a diagnosis of IBS and instead of just living with it and trying to medicate it, I've been able to cure that essentially.
Wow.
And so me doing this and getting into all these alternative methods and things is just because there's so many more options out there. There's so many things that aren't pushed by traditional medicine that people need to know about. Also, Lauren, can you you're typing.
Not type.
Really picking up on the mic.
Okay. I saw you make that face and I was like, yeah, okay. So you mentioned, you're a doctor, you were running a health business, like you were otherwise pretty healthy, yet you still had lifestyle changes that would help with this diagnosis once you finally got into it and got a true diagnosis, went that cash route. Can you tell me a little more about how you were already probably living a relatively healthy life, but what were some of those nuanced things that you had to change to help?
A big one was just still like with the gut infection especially, it was there was a lot of lifestyle changes that needed to be made. So I had to go on an elimination diet for a period of time, figure out what really bothered me, what was irritating my symptoms. It was a lot. What was really interesting, actually, was when you go to this functional medicine doctor, Dr. Zub, who I started with, her intake form was like 14 pages long. It took me 90 minutes to fill out. And one of the first things I noticed on there as I was filling it out, there was this thing called the Adverse Childhood Event Score. And I am someone that I am very successful today, I would say. I'm happy with where I'm at in life. And I thought I had a pretty good childhood, regardless of the fact that my mother was a kind of deadbeat alcoholic, and I've been estranged from her since I was 8 years old. And I did deal with some things as a kid that we don't want to deal with, I guess. But I thought I kind of had gotten past that. And I scored an 8 out of 10 on this test. And I was like, and it's a 10 questions. It's a yes, no. Did you experience this? Did you experience that? And I was like, well, yeah, I did. And I guess I did this too. And I saw that and felt this. And I was like, shit. And so when I went to the functional medicine doctor, she held up this sheet and was just like, do you think this has, and she, before that, she prompted me with, okay, tell me about your personal life. Tell me about your business. Why do you have multiple different businesses? Why are you in this stressful, like you keep chasing stress? She goes back to this thing, this ACE test, and goes, do you think this has anything to do with it? And I was like, I don't know, maybe. She's like, you grew up in a very stressful environment. You learned to live on stress. You learned how to cope with stress very well, but that is how you learned, what state you learned to be in is just stressed. So you've been chasing it to keep yourself busy and occupied. It's like, you really need to go to therapy and deal with some of these things and like get to the root of some of these things, because maybe your brain deals with it well, but your body is completely taken aback by what you're putting it through with the mental and physical stress that I was putting myself through at that time. So a lot of it was going to therapy. It was trying to figure out where to go with my career as far as being a business owner and having more balance in my life, and trying to get unstuck from some certain things and get a better vision of my company. And also just, for me, it was like I was at a point where I wasn't really satisfied with a lot of things, or I wasn't content. And it was just kind of learning to be present, to be grateful, to have gratitude for like where I was in that point in time, and not just looking at the next thing, but like taking in where I was in the moment, I guess.
Did your personal experience inform the way that you treat?
Very much so. And that's part of why I started the podcast. Was I see so many people that come in all the time now with autoimmune disorders, with all these systemic inflammatory issues, PCOS, endometriosis for women, all kinds of these weird things we're seeing more and more of now. I have a patient now that has all the symptoms of ankylosing spondylitis. We've been to 3 different rheumatologists together now, and she still doesn't have a definitive answer of what's going on. And so, but no one has taken action for her or done anything to actually get to the root of it. It's all been, let's try this medication for this. Let's try this. When no one with her has had had a conversation about nutrition. No one has had a conversation about sleep, recovery, stress management, any of that stuff, which is what we're trying to do. And just for us, it's really about being able to advocate for our patients on what other things they can do. And, the average doctor has 7 minutes with the patient. They don't have time to diagnose someone. So when you come to Barbell Therapy and you do an evaluation with us, it's an hour, if not longer, of us trying to get to the root of what precipitated this, what factors were involved there, what things are going to make this better, what's going to make it worse, how do we come up with a game plan, But sometimes just getting to the root of like why this is the way it is right now takes us an hour. And we have 7 years of education in the musculoskeletal movement neurological systems, where a doctor, like your primary care, doesn't really have all that much training in diagnosis of musculoskeletal conditions. But people go, they spend 7 minutes with them and they say, it's arthritis, it's this, stop doing this. When really, that's not the case. Of, if you have pain with running, maybe the doctor should look at you run. Maybe the doctor should be able to, if you have pain squatting, why isn't the doctor looking at you squatting? We're just telling these people arbitrarily to stop doing these things. I had a woman a couple months ago come in, and she had some elbow tendonitis, mild, but it had been bugging her for a few weeks. And what had happened was she whacked her elbow on a doorknob, and it bruised over and just kind of came into this inflammatory state that wasn't getting better. And she went to her doctor, and her doctor knew she did some powerlifting. She's in her 50s, not competitively, but that's how she liked to work out. Her doctor told her, as a 50-year-old woman, that she is probably, as a woman in her 50s, women at that age probably just shouldn't work out or lift weights. When we know there is so much evidence behind the benefits of strength training, especially for women, for bone health, to prevent osteoporosis, for heart health, for insulin sensitivity and insulin resistance, to decrease metabolic disease. Exercise is the number one thing that, if it was in a pill form, would be the most prescribed drug in America. There's literally almost nothing it's contraindicated for. Yet we have doctors out here telling people, just because of their age and their gender, that they shouldn't be lifting weights. And she didn't even get hurt working out. She hit her arm on a door.
And it probably wouldn't have hurt as bad had she been working out.
Yeah, I mean, she was having some pain with working out after that, but it was like, well, this wasn't even the root of it. And we're just putting these blanket and umbrella statements on things and saying, stop doing it. And so, you know, and there's a saying, bakers bake, fighters fight, surgeons cut. So a lot of people just go into these things, and it's like, another big issue we have is structure versus function. So 50% roughly, depending on what cause, whatever, but about 50% of people will have abnormal findings on an MRI that is asymptomatic. So if you look at disc herniations and sciatica, 50% of people can have a disc herniation and have no pain, no symptoms, no findings, no dysfunction, nothing. They don't even know it's there until it's scanned. Now, what we see too with disc herniations is a great example of someone can have a disc herniation and they can have sciatica, symptoms of like shooting pain down the leg. Now, what can happen with that is, what we see in the rehab process is that herniation can fully resolve itself. And two things can happen, or a couple different things can happen. We see that the disc can fully resolve itself back into its place, and some people will still continue to have sciatica, even though structurally it's fine. Functionally, something's going on. We can also see the opposite, where we can see the disc not resolve and still be intruding on the nerve, yet these people become asymptomatic and have no issues. So what that means is structure does not always dictate function, and that the answer or the solution to your problem is not always structural. There's half of the equation is function. Now, when we go to a doctor in pain and we look at an image and they just say, oh, you have a herniation, let's do surgery. Because I can bill a lot more for surgery than I can just consulting you in the office. Let's do that. Versus, well, did we try physical therapy yet? Did we do all these things? And then the other thing is, even physical therapy, like most of my colleagues that practice in a traditional setting are seeing 22 to 30 people a day. They're seeing 2 to 3 people at a time. In that case, and so when I was a student, I had to practice this way because you were assigned a hospital to work at or whatever, and you can't manage anyone that way. I can't do my best by anyone by having to treat 3 people at the same time. Or if if you go to a hospital-based practice, you get a half hour with patients. I can barely do anything in a half hour. Like, usually for me, I take 20 minutes to have a conversation with people about what they're dealing with, how their week went, what ergonomic factors, stress factors, whatever. So it's just like people go to try PT and it's like it didn't work. It's like, well, what level of PT did you have? Like I tell people all the time, not to brag or anything, but I consider what I do, I really believe in what we do work, because we have the resource of time with people. We spend an hour with people one-on-one. Where did you go to McDonald's and get McDonald's level service at this PT clinic where there was one therapist working with 3 people at a time, or you had an aide that's a college kid that doesn't even have any physical therapy training yet, and someone that doesn't understand that you're a competitive athlete and what forces, demands, stressors are placed on that body in sport? Or did you go to a place that's like the Capitol Grill that understands you, knows what things you need to do, knows how to get you back to where you're going to go because they've done it themselves, and really know how to guide you all that way, and someone that's open to learning about new things and coming up with a better answer than just live with it or stop.
Yeah. I mean, there's so many good things you've said in all of that. Just to kind of share and even give an example from my own life and working with you, right? So I've seen you as a PT, and I have seen cash-based PTs before. I've seen the traditional PTs. I did cash pay a long time ago because I'm in therapy. It's the same, right? Same idea. You're able to do a lot more and practice in the way that is best for the patient. But, even looking back, the cash pay, chiro and PTs I'd been seeing that were still great and did a good job. But even where you differentiate is your explanation. Like I keep getting this recurring back thing, and you're figuring out how it relates to my core. But they just kept telling me you have a weak core. And I tell you that, and you're like, you don't have a weak core. It's just misfiring. And that's when it clicked for me. That was like, okay, because I could squat 300 pounds. Like, there's no way I have a weak core. Like, this doesn't add up. And then I'm just sitting there going, well, yeah, I don't really have abs. Like, I must have a weak core. And I'm going through this whole thing in my head for years going, well, I have a weak core, I have a weak core. And you're like, get your butt in here. Like, no, you don't. Yeah. And then your explanation to say, like, it's not that it's weak. What they meant is that it's not firing the way that it should, or probably a better way that you said it. But, that clicked for me. It was like, okay, so even these places, you have to also know to ask the right questions, or the person you have to know can explain it well, which is, I think, what separates you guys, even all of the PTs at your clinic that I said, they come over and saying stuff, and I'm like, wow, what a good crew you have there. So how can these patients that are going to, let's say, even traditional healthcare, how can they know to push more and go beyond? How can they know to advocate for themselves?
I would say you really have to trust your gut and really be firm in your beliefs to take action and speak up, because healthcare practitioners are very intelligent in certain ways. We've passed a ton of very hard, academically rigorous examinations. And so we do know a lot about a lot of different things and different body systems. And like, people think in physical therapy that, people come for shoulder and knee pain. It's like, well, we also work in the ER. We work in inpatient multi-trauma units. We work in acute care. We work with geriatrics. So we know the lifestyle from when you're born. We have to know all about the development of them all the way through. We have to know the cardiopulmonary system. We have to know the neurological system and every piece of the brain and neurology. We have to pass all those classes. We have biochemistry. We have pathology. We have organic chemistry, pharmacology, and the list goes on. So we know about a lot of different things. And I think the problem is, a lot of times through our own biases, we're proven that we're right about things. And so when a patient comes in and questions them, it's very easy to shut them down. It's like, no, this can't be it. And it's hard to be a patient in that sense. And like, I sometimes feel bad for when I'm the patient and I go into a medical office, I kind of feel bad for them because I will challenge them. And I'll walk out sometimes. I'm like, why didn't this person know this? Like, when I was dealing with all this, I had to get a colonoscopy at age 30, which you're not supposed to have one until 45. But my gut, like, we thought I might have cancer. And so it was like, let's take a look, make sure there's no polyps or precancerous lesions, stuff like that. So I went in, had my procedure, came out, like, you're clear, there's some inflammation in there, we don't know why. I was like, all right, well, what do you think, doctor, about BPC 157? He goes, what's that? I was like, are you kidding me? I was like, you're a doctor who's in this field. Now, BPC is, for those of you that don't know, it's a peptide that's been around. It's made from gastric juices that are endogenously made in our body, that we can now supplement, and there's very good animal studies on them. There's some questions about them still, but so far the research and data on them looks like it's very safe. Could be a very good outcome. We're finding it's reversing Crohn's, it's reversing colitis, it's helping heal leaky gut syndrome. He had no idea what it was. It's like, and so there's that, right? And what is the problem there? Well, I think the big problem is a lot of these new alternative measures that we have now, like supplements, nutrition, peptides, hormones, all these different things that we can start to play with in our body if we need to, right? There's no patents on any of these things right now. So the other piece to this too is traditional healthcare. What I learned, so if anyone's interested in this stuff, casein calamines, caseamines was I'm going off on a tear.
Yeah.
But anyways, I'm going to get back to my point.
Okay.
Caseamines was a last year resident at Stanford Medical University as a surgical ENT. She dropped out because she just realized she's giving people medications, doing all these surgeries. No one's actually getting better. No one's breathing better. Everyone still has all these issues. And she's now in like government trying to create policy change along with her brother, who's a politician. And so her thing was, and she's on a bunch of different podcasts now, Rogan, Tucker Carlson, all these. But her thing was, she's like, I got one lecture in medical school about nutrition. 75% of Stanford Medical, Harvard, Yale, they're all funded by big pharma, right? And then is the farmer coming into the doctor's office telling them how important eating an apple a day is? No. Right?
No, they're dropping their supplies as trials so that you sell it.
Yeah. And so you don't have any of that going on. You have this bias towards this. It's how do we use this medication? Let's use this medication. That's primarily what doctors are taught. Pharmacology, all that stuff. And then the other piece is that, all their options we have, the juice isn't worth the squeeze for a pharmaceutical company. So there's no patent on bioidentical hormones. There's no patent on supplements and herbs. There's no patent on fruits and vegetables. There's no patents on peptides. So these pharmaceutical companies aren't pushing any of them, and doctors aren't looking at them because they're just not in their face every day, when these could be great alternatives or even future standards of care for our patients. Because a lot of these things don't have major side effects either. And the other problem too is, I just had this fight. So my dad is 70. He has low testosterone. We went to his doctor. I was like, hey, he has low bone density. He has atrophy in his shoulder after surgery. He has issues with his sleep. He has all these symptoms. But no, we're not going to put him on that. It causes cardiovascular risk and increases the risk of prostate cancer. I was like, that is a study from the 90s that showed that, from the early 90s, that showed taking testosterone increases your risk of prostate cancer by 13%. 13% of all men get prostate cancer. And now there's actually studies coming out finding that having testosterone replacement decreases the risk of prostate cancer and a lot of other things. Same with women. Estrogen. The Women's Health Study in the 90s showed increased risk of breast cancer and I think cardiovascular disease. Well, they were using horse estrogen.
Jesus.
Which isn't the same.
Yeah.
It's a bioidentical female estrogen androgen. So there's lots of issues there. And then the other, so we have all these issues that people just don't know. And it's easy for a doctor to shut you down on them. Versus go, maybe I'll look into that. And then my other piece here too is just we do so much symptom management. And so like when you actually came in, I'm going to talk about your case for a minute if that's okay.
Yeah.
You came in with shoulder pain, right? You had a labral tear. It was confirmed on MRI, right? And in a traditional setting, with the limited amount of time I have multiple patients to manage, I would probably look at your shoulder and go, okay, your shoulder has some owies here and there. You have an MRI tear. Let's treat the shoulder. When really I said, okay, we'll look at the shoulder, but let's look upstream. You get headaches? Oh yeah, I get headaches every day. Oh, you have neck pain? Yeah, I have neck pain too. Oh, well, when does your neck hurt? Oh, the same time my shoulder hurts. Okay. Does the shoulder get worse when the neck's worse? Yeah, it does. Okay. Sounds like we have a combined issue here of we have neck issues that are causing shoulder issues. And primarily that's what we found with you is probably, I would say 80% of your shoulder pain was coming from your neck.
Yep. And we assessed lifestyle. We did, just to give people context, like, he's like, send me a picture of your desk that I know you're sitting at all day long, and what does that setup look like? And it really was a game. It's like, you looked at, and you explained it well. What are you doing for what I thought was 12? We've now learned to spend 15 hours a day that I'm maybe sitting at my desk a little too long. And I'm like, yeah, I'm a hard worker. Like, this is good. You're like, no, you're destroying your body by sitting in this position for that time, And that has been a huge game changer. And all this time I'm going, I know I haven't been as good at working out. Like, I know. And I'm like a fitness person. So I'm like, I know this is the problem. And it's like, honestly, it's a problem, but let's look at what you're doing for the 20 other hours in a day. That might be a bigger problem. And you even earlier talked about, when you mentioned, I want to bring this up about lifestyle changes, because that's kind of what I'm talking about here, right? You were saying in your own life, and I was kind of getting at, you probably worked out, you probably ate pretty clean, you probably did the stuff that you're supposed to be doing, right? So what are those things? And it's interesting that you said, well, first we had to assess. So I think people who are on the other side of the spectrum, who are aware of their health, aware of what they're putting in their bodies, they hear lifestyle changes and they're like, no, I do it right, man. Like, that's not the problem. And it's like, well, you might be doing it right compared to the rest of America, but are you doing it right for your genetic or your biological makeup? And that's what we need to assess. And so that's where those people who are like optimizing their health, so they think, I think that's the difference there, is what you're talking about, is like, there's the one end of the spectrum of people that don't really work out, they don't know, and, they just kind of need a base level of like some education, right? And then there's people over here that are doing what they think is great, or, I used to be overtraining. I was on the other end and ended up with a heart condition and all that. And it's like, now I'm sitting here going like, well, I know a lot. I know what I'm putting in my body. I've done it all. And it's like, well, lifestyle doesn't mean just, are you taking care of your fitness? It also means, is this something you're in your foods that's seemingly healthy for most people, unhealthy for you, unhealthy for your gut? And I think that's a key difference too, for both ends of the spectrum.
Yeah. And that's kind of something back to functional medicine is like, yeah, I thought I was being healthy too. And, I do eat a pretty clean diet. Like, I'll still go out on the weekends and have a cheeseburger and a beer or whatever once in a while. By once in a while, I mean like every weekend.
You said it, not me.
But through the week, I had chicken, rice, broccoli, whatever, the typical, pro bodybuilder type diet. And with my gut symptoms, I didn't realize all these cruciferous vegetables were making my gut way worse. I had to literally eliminate more than half of the vegetables I was eating. And like my chosen vegetables were typically cruciferous, and they're making me worse. And then,
I feel like every female gets diagnosed with IBS too. And that's another comment, like for my whole life. And I figured out from my own intake that those cruciferous vegetables made like bloating worse and stomach pain worse. And I find if I just cook them, it does get rid of some of that. And some of those just cooked made a slight difference. Like, but you have to be really aware of what you're putting in your body to see that.
Yep. Yeah. And there's a lot to that can be very targeted. And I think that's the other thing we miss in general medicine is it's very general. You go to the doctor you go to your traditional primary care for IBS. It's like, we'll take this and eat like the brat diet or something, or this low residue diet of like bananas, toast, apples, and peanut butter or whatever. Where for some people that might work for a little bit of time, but that's not really a healthy diet overall. And then you can just look at all these blanket kind of things they tell people to do, and it's like, you have 7 minutes. It's like, as a practitioner, what am I going to tell someone? Yeah, do the Mediterranean diet, do this, do that. Like, get out of my office.
Yeah.
Where when you really break it down, like when I went to the functional medicine doctor, it was really cool because we did a shitload of blood work. And we went through every piece of it and was like, okay, this is good. Okay, that's not good. We're going to do this. We're going to do that. Like, don't worry about this. You don't have to eliminate these foods. You don't have to do this. Like, instead of going through this crazy elimination diet, I didn't have to do that. I had to eliminate certain things that we knew based on all the extreme testing we did that these things were problematic and these things weren't. So picking what you need to work on. But then for me too, is like, there were certain probiotics because my gut was so far one way. If I took a certain type of probiotics, it would have made my symptoms worse. So I needed to have, there's all kinds of different strands of probiotics and gut microbiota that live in there that sometimes we need certain ones and not others. And so it's making sure you can get pretty specific on what you need, which we can do these days with modern science. Just a matter of how hard you're going to look for the right answers and the right practitioner for you.
Yeah. What about, let's talk about sort of the financial component, because insurance, you could do a whole episode on that and its issues and things like that. But what about people who truly are like, maybe they don't have the extra cash, maybe they do for like a one-time visit or something to get at least put in the right direction. What do you suggest for someone who really wants to dive into this, but their resources are limited?
We'll say this because I don't want to confuse people. We do take insurance. We take most major insurance carriers. So we are a hybrid clinic of we're cash and out of network. And I would say you really have to think of this. So a perfect example, a patient I'm dealing with now that is having all these IBS symptoms, rheumatoid symptoms, cardiac issues. I put her in touch with my functional medicine doctor that I use personally now, Dr. Fate, who's been on the podcast before. And, it is a cash-based service, and it is more expensive than you just going to your primary care and getting, your $25 copay and your 7 to 15 minutes with a doctor. Now, when I went into this appointment with her, with the functional medicine doctor, there's a physical therapist with her advocating for her. There's the doctor that I know and trust. And we spent an hour and a half together talking about her case, all her findings, what I found clinically relevant, this and that. Right. And so he had some findings that were like, okay, like these are things no one's looked at. These are clearing issues. Let's fix them. Here's the game plan. She came back next week. I was like, hey, did you start, the gut protocol that he wanted to do? She's like, I don't know, what's really expensive. She's like, I don't have a lot of money right now. I was like, hey, you, because of everything that's been going on, haven't been able to work as much. You've cut your workload down to like 10% of what it was. You're suffering every day. Like, what is the cost of you continuing the cycle of poor health, poor medical management, and you not taking care of things? Like, this is an investment, and either way, we're going to learn, like, this either works for you and it gets you better and gets you towards where you want to go with your goals. Maybe it doesn't, but then we know that doesn't work. So either way, it's an investment, but it's like, she kind of sat there. She was like, damn, you're right. She's like, I have to do this. I was like, You've been misled by the medical system so many times now. We've been to 3 different rheumatologists that have given you no answers and literally scoffed at me, scoffed at her. Like, and it was like, I wanted to punch this rheumatologist in the face.
Yeah.
And to be like, yes, this is going to cost a little bit more money than you're used to, but it's going to get you back to working, possibly. It's going to get back you to not suffering, to spending all this time and money on physical therapy, on all these extra doctor's visits, all these unnecessary medications. And long term, what is it like too?
Yeah.
What does your future disability look like, and how much is that going to cost you down the line?
I teach, I'm an adjunct professor, as you know, and I teach a health and wellness class. And what we did for one class activity, because I'm much more experiential learning, these kids aren't going to, watch me lecture for 2 hours. They just aren't. And what we did was we walked through the two lifestyles of someone. We gave them their history. And one was like someone who grew up playing sports, someone who eventually got into health and fitness. It doesn't have to be anything crazy, and like buying supplements and stuff. And I walked them through the financial aspect, and intentionally was like, and then the other person was like overweight most of their life, all that kind of nutrition, all that stuff, like then the diabetes and all the health stuff later. And we walked through, and I said, they were all like, yeah, of course, the, person who's got the health stuff is going to cost more. And I'm like, whoa, let's back up. In the beginning, this person is spending more on their health. Like, let's talk about that. They are spending more on nutrition and things like that, but it's an investment. So later they don't spend as much. And over time, who spends more, right? And it was like, I'm trying to do what you're doing at a smaller level for these 18 to 20-year-old kids who maybe two of them it sticks with, right? But kind of showing them, I'm not going to lie to you and say that it's not expensive to invest in your health. And he even shared a personal story growing up. My mom's an RN. She's not like in the health and wellness the way that we are, but, overall, she raised us relatively healthy. And she was at the grocery store with me and my two sisters when we were young. I only know the story anecdotally. And someone said, hey, you got 3 young kids and your cart is full of, vegetables and like healthy things. And I just want to compliment you. And to her credit, she turned and said, I'm lucky I can afford to, because eating healthier is a little more expensive. And, she never let us forget that like, let's not just judge these people, right? But then you hit a point where you have to choose your investments, and you have to choose to make those investments. Much like that. I had a leaky gut issue and invested thousands of dollars in that and healed it. But over time, I spent less on supplements to fix my stomach issues and bloating and all those things, right? So I like the way that you were able to bring her there. Do you have any advice for people who maybe are still stuck in that way of thinking? What might you suggest to them to try to shift their mindset?
Yeah, it's an interesting conversation. Actually, I just had Krista Scott Dixon on, who's a psychologist and nutritionist, and I actually told you should reach out to her. Like, you guys would have a really cool conversation.
Oh, all right, on it.
But we talked about this of like, hey, organic, non-organic, this and that. Like, how do we go about choosing the stuff? And it's like, we all have to live within our means, and finances are issues for someone, especially these days, and the cost of groceries is insane. And you do have to kind of pick, and it's like, hey, we're in a world now too where it's like social media is, you have all this shit out there where you have people saying we should only eat plants and be a vegan. We have other people saying don't eat plants. Paul Saladino says plants are bad for you. Let's only eat meat. But then he's changed his statement now, and now he eats fruit. You have people saying, this one piece of broccoli or this one phytochemical in broccoli could cause this pathway to ignite cancer or something. And we have all these different things saying different things. I think if we just could, at the minimum, get enough fruits and vegetables and fiber in our diet and eat less, the less processed you can do, the better, really, at the end of the day.
Yeah.
Look at the ingredients. Like, you can get a thing of Lay's chips that have, look at the ingredient list on that. Like, I go to Trader Joe's and I get potato chips that are literally potatoes, olive oil, salt. Like, why are we putting all these extra things in our body? And just, it is something you have to realize. Like, chicken is good and has all these health benefits, right? Protein, this and that. But then it's like, well, what about the hormones it's being fed? What about the way it's being raised? Like, is this, chicken or cow just full of cortisol because it's crammed in this room with thousands of other chickens all day and can't be a chicken? Like, you're eating those hormones. Like, you are what you eat, in a sense of those things are in that. And like, if you just look at like a piece of grass-fed, pasture-raised, grass-finished piece of beef versus a corn-fed one that's raised in a stall that's just being pumped with hormones for production and profit, the meat looks different. Even like I got eggs, and I had to go to Costco because there's an egg shortage now.
Yep.
And I thought they had organic eggs there. They don't. So I had to get the regular ones. And just the difference in the way the yolk looks, I'm like, it looks unhealthy. Now,
Yeah.
granted, eggs are still good. So, and I don't think anyone ever died from eating eggs. So you have to just pick your poisons of what you can do and not do. And like fruits and vegetables, there are some differences in like which ones are just dirtier with like leached with pesticides. More so like strawberries are a big one that I love. So like I buy organic strawberries. But like a banana that's in its own thing, like I don't have to buy organic bananas because they're not as dirty with pesticides on the inside because you're not eating that. So
Right.
different things.
That makes sense.
There. Yeah. But
Yeah, there's a lot.
Just trying to eat the most natural you can in least processed way.
Yeah, I like that. There's a couple good points that I want to hit on too that you mentioned about, the guy that like changed his view and stuff. And it's like, and yes, there's a ton of like info out there, a ton of misinfo, people uneducated out there putting stuff out there that are like, I'm an influencer, like, all that stuff. But I do commend the guy for changing his opinion publicly, because I think that's a thing that I think doctors, while I go in going, I think a lot of people go in going, I know they're smart, so I'm just going to listen to whatever they say because they know more than me. But then and I've had plenty of poor bedside manner doctor experiences where they say inappropriate things, like rude things, and just, they don't realize. But a lot of them also, when you advocate, are not willing to admit that they might be wrong. And that's a problem, right? Is like, you're questioning me. It's like, I'm not questioning you. I'm just trying to understand a little bit more. And that's, I think, a problem too, is like, if you're not able to, and I remember I came home and shared this at home when I was with you, and I asked you a question about an exercise, and you're like, you know what? Let me ask Connor. And I'm like, I respect that so much, because how can you know perfectly everything? Like, you were right about the answer, but you're like, let me just confirm. To me, that shows more. I don't want a doctor who thinks they know everything. I want a doctor who knows a lot, but is willing to know what they don't know and realize that two brains are better than one. And I think that's kind of where, when it comes to like I commend people who are willing to change their opinion, especially publicly, and be like, you know what, I was wrong before. Now he might not be right this time, but at least he's willing to say like, yeah, I failed publicly. And, here's what I think now based on new information. It shows that they're continuing to grow and learn, at least, whether this guy's a good example or not, just in general. And just to bring it back to like why doctors might not listen to you, might be dismissive of you, is they almost are like, well, I do know more than you to some degree. And so it's, sort of that issue too of, and it's not everyone, and I don't want to overgeneralize, but I've certainly had those experiences. And, even when I had my heart condition, actually, similar story, I'd had mono, and my doctor didn't know me well. And I was like, when can I go back to sports? And I was a 2-sport college athlete. And she's like, you can't contact for 3 weeks, but after that, when you feel good. So what did I do? I'm like, she's like, but you can work out when you feel good. It wasn't even 3 weeks, and I was out on the turf sprinting around, getting ready for preseason. I'm like, I got preseason in 2 weeks. Sorry. End up with a cardiomyopathy because the virus was still in my heart and needed to work its way through or whatever. But I look at that, but in order to find the heart condition, I went to 5-6 doctors, and it wasn't until I cried to a nurse saying, nobody is listening to me. Something is wrong. And they sent me to a cardiologist who caught it. And she was like, I'm so proud of you for listening to your body. And she was like, I'm a runner, so I know that this is hard for you. She also like acknowledged that I understand me telling you, who's about to turn 21, that you can't have alcohol, you can't have caffeine, and you can't work out. I basically just took your life away from you. And I was like, yeah, like, what do I do besides study? Like, and I couldn't work. I had to like take time back from work, and I was working a couple jobs too. So I was like, I took more classes, which was probably not the stressful answer, but you think about that, and it's like, I knew to advocate, and my mom's an RN, and she was with me and telling me like, push. Yeah. But you also have to know, okay, this person isn't a faker. A lot of people do tend to like, have that issue. So, there's so many different components, but I guess overall, like, what do you wish, what's like the biggest misconception that you wish people, that you hear, that you want to like stomp on and push away?
Oh God, there's so many. For me personally, in my profession, it's like that you need surgery. We see so many unnecessary surgeries. And I think the overarching thing is there's always another option.
I like that.
Every option has, might have a pro and a con to it, but there's always usually something else. Like if you go, very few times should you go to a doctor and get this is the way it needs to be. There's typically always options. Now, is one the best? Maybe. And can the doctor have opinion about what's going to be best for you? Absolutely. But if that's not what you want, right? Maybe it's a more invasive procedure. Maybe you're scared of that. Maybe there's some fear avoidance affinity, whatever. Or maybe you have things going on that, like, now's not the time for you to take 3 months to be laid up in bed, right? Is there something we can do in the meantime? Maybe, probably. There's so many different things. And yeah, one of our things is, one of our core values is stay humble and be curious. And it's like always knowing there's more out there to know. We don't know everything, and being curious about it and seek to understand that thing and then advise. And I wish every healthcare practitioner kind of had those values, which we just were lacking in this field, I think. And so that, I think, is just the big thing. Is my big message to people is there's always another way to do something. I believe the human body, and part of one of the PNF principles we follow is, and one of their core principles is, every living thing has potential. So anything that is a living organism has a potential to improve or become better in some way, right? So it's not just take this drug and do this. It's not just get this surgery and do this. Like, we can improve sleep, we can improve nutrition, we can improve mindset, we can improve all these different things, even in physical therapy. We can improve the way you're doing something, the way we have to modify something, making things easier for you sometimes. And these are just things people don't see, of all the potential options they have out there in the medical system, because they're just not pushed by insurance. So that, I think that's the big thing, is that. And then the other thing too is I have two parts here, is like the new thing I'm learning now is, and it actually makes a lot of sense, when you go, so if someone wants to save money in the world of healthcare, before you have a procedure or anything done, ask what the insurance rate is versus the cash rate, or find out through your insurance company. Because if you think about it, right, say you come to me for physical therapy and I want to make $100 an hour, just for easy math, right? Okay, I could charge you $100. Now I don't have all these administrative fees. I don't have to deal with documentation to send to the insurance company. I don't have to deal with denials, billing, coding, all this stuff, audits, blah, 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 right? I could charge you $100 and be happy with my day, right? Oh, well, now you want to go through insurance. Okay, well, insurance still needs to pay me $100, or you may need to pay me some of that, but then the insurance company wants to make money too, and they make an astronomical amount of money. So, great example of this is I had blood work done through my functional medicine doctor, and I use LabCorp with my PCP that I still go to just for general checkup, and I have my functional medicine doctor. So I prepaid the doctor. It was $250 for this extensive panel of blood work. I went, LabCorp accidentally billed my insurance company. Now, $250 was supposed to be all I paid. I got a bill from my insurance company for $1,200.
What?
And I was like, what? They're like, yeah, you billed it through insurance. I was like, well, I didn't want that. I paid this. They're like, okay. They reversed the claim, whatever. Not a huge deal. But I'm like, why are we, like, 5xing almost the cost of this on people?
Wow.
And then I had someone else. There's a new place up in Nashville, Teleca Imaging. They're a nonprofit. It's an awesome business. $600 to get an MRI. You pay out of pocket, but you have your results. You can literally go in that day or the next day. You have your results in 24 hours. They have AI that, like, puts it into 5th grade so you can understand it and not just have this medical jargon. They send it to us. It's awesome. Everyone we've had go there has had great success, been very happy. $600
That's awesome.
is the max you're going to pay. And they can still bill your insurance too, but they won't charge more than $600. Somebody I know just went $2,200 for an MRI.
And they don't get the results for weeks, and and you never actually get handed the disc half the time, and you're like, where is my disc?
And no one has discs anymore, but that's
that's how long it's been since I've gotten an MRI.
There was another one too the other day. I saw a kid had to be rushed to the emergency room, and he took an ambulance, and the dad didn't have his insurance card with him. He only had his ID. So it went through. So he got a bill in the mail for like $600 for the ambulance ride. He said, no, like I have insurance. I want to bill this through insurance. They push it through insurance. He got a bill for $1,300 because now you still have to pay the ambulance, but insurance wants to, double their profit too. Yeah. So always just ask what the cash rate is versus insurance. That's a big thing.
I like that.
Yeah. Another piece too, as far as like cost and healthcare and thinking about this. So my dad recently had a scare with prostate cancer, actually. And they messed up his schedule a bunch of times. He sat for 2 months waiting. He had an MRI, or he had like blood work that showed like his levels were significantly elevated. And he had an MRI and was supposed to have a biopsy at the same time. Well, his doctor forgot to tell him to come off of his blood thinner that he was supposed to for the biopsy. So they scheduled it out like 6 weeks later. He had to fly back to Florida, come back for it again. But for 6 weeks, all you could hear in this guy's voice was regret that he didn't do something else earlier in life. And that was kind of a wake-up call for me, too, of like, I've been spending more money. I've been buying more organic products and things. And I'm like, what is the point of it? Whatever. But then it's like, oh, like, if I were in his shoes now and being his son, like, looking at that, it's like, you know what? Maybe I should spend more money on this so I don't have these regrets later of all these things that add up of, like, what could I have done differently earlier in life to prevent these things from happening to me? Because no one thinks it's going to happen until it almost does, or it does happen.
Yeah.
And it's a scare. Yeah. It's like, oh, that's a wake-up call. Like, can we just take that earlier and think about these things for later on down the line? Because what does that cost you?
Yeah. I mean, it's a really good point, and it's a really good take home of like, it's a exercise I do with clients a lot is like, what do you want people to say about you at your funeral, right? And if that's a good way to determine how do you want to live your life, right? Because if they're going to say that, that means you have to have behaviors every day that lead to that, right? So it's a good way for people to kind of come back and go, well, am I living that way now? And in this world, it's kind of the same. It's like if what do you want to die of, really? It's like, to make it an extreme example, or like, what health risks are you afraid of getting based on your family history or based on, and it's like, well, then what should I do in order to do that? I'm 33 and I'm thinking about my life, and like, I've lived a very healthy life, but I'm also sitting here going, okay, especially women of my age who haven't had kids, and maybe you want to have kids, you're not sure. You're sitting there going, is there anything left I can do to make sure that I'm as healthy as possible, right? Fortunately, I've lived a very healthy life up until now. And so there isn't a ton of changes I need to make, but you have to really think about where is this headed and how is what you're doing today impacting your life later on, both from behavioral standpoints, from health standpoints, all of that. We've covered a lot here. There's been some great points that you've made. Is there anything else you want to make sure people take away from this?
I could go off on these topics all day. I just think, in this field and seeing different things, there's so many different options. There's like the fields are growing, they're changing. There are more and more providers coming out now that are kind of practicing alternatively. And you can see that changing. There's more and more of these like micro cash-based clinics, boutique, studios or whatever, alternative medicine, functional medicine. Like, I think that's where the future of medicine is going. And if anyone really wants to make sure they're healthy and maintains good health all through, we should be seeing some type of functional medicine doctor, naturopath, homeopath, something of that nature, where we're looking at nutrition, we're looking at lifestyle factors, talking to a therapist too. Like, take care of your shit of where you came from and why and what you've been through, and figure out why you are the way you are and how to deal with those things better. And there's so many different options now, and like there's so much that people still shut down. And so, like, for me, I've always been someone that's been pretty open-minded to a lot of things. And I'm always curious. Like, so if I'm doing something if I recommend something to a patient, I'm going to have tried it first. I've done ketamine. I've tried that because like I had a patient that had really good results with it and like changed his life. And I was like, damn, like if this is better than an SSRI, which has a ton of side effects, and you can live your life better, like I want to see what that's like. And if it's relatively healthy and safe, let me try it. And that, I've done the peptides, I've done functional medicine, I've done all these different things, right? And there's so much out there. And even in my practice, like I've always been open-minded. So like dry needling is something that really helped me early on when I was having these ankylosing spondylitis flares and stuff and I wasn't medicated. And I saw it work really well for me, and I could see it anecdotally working well for others. Well, back then, 10 years ago, and the problem with science, I guess, this is kind of like closing, I guess. There's a big problem with like the way we practice medicine and science, as I see it, in that, especially in physical therapy, it was so much evidence-based practice that everything you did almost had to be proven by science at that point in time. So at the time, dry needling was still a newer modality when I was coming out of school, and I got registered or certified to do it, and I started practicing it and had really good results. I built a successful business with it. But people like professionally would shit on me all the time and think I'm a bad person because I was using this needle to placebo someone into getting better and this and that, and you like fucked with their biopsychosocial sphere of dependency and this and that. And I was like, I think we can word it a different way, and we don't have to use these false narratives and negative narratives for patients and still empower them. And then 10 years later, now it's in the clinical practice guidelines as like a very important course or factor in a successful treatment for low back pain. Right? Same thing. A couple of years ago, we got into regenerative medicine with shockwave and electromagnetic therapies. And I was not bought in right away. I had an experience with it though. And I was like, this is the only thing that fixed the tendonitis in my arm that I've been dealing with for 2 years. And it was an 8-minute treatment, and I was good for 3 weeks without any issues. No symptoms.
Wow.
And I was like, okay, let's look into this. I looked into the data, not a ton of it, but it looked very promising from what was there. I got a device. I got hate mail from like PT students, other therapists telling me, this is a placebo machine, like you're doing an injustice, you're just trying to sell bullshit, this and that. 2 years later, I have at least one physical therapist every week emailing me, asking me about shockwave, coming in to learn more about it, to experience it, which is really cool that I've been able to be on like the pioneering end of this stuff. But so many people are closed-minded to these things that like, just because science hasn't proved something yet, doesn't mean it doesn't work. And that's one of the big problems I see is so much of what we do, or so much of what medical providers will do, is put something down because there's no evidence to support its utilization or efficacy yet. But just because we haven't proved something works, or just because we don't understand how it works, doesn't mean it doesn't work.
Yeah, you're spot on. And kind of 2 quick bullets to wrap it up from like any healthcare side, right? Is that one, I think I told you this before, but my mom had said it and I was like, wow, that's spot on. That she used to say by the time a medical book came out, it was outdated, right? Because it takes so long to go through the IRB review process and research. And like, don't get me wrong, I love research, but I also know its limitations. And that is that it's, by the time it gets published, it's gone through how many things, and it needs to be worded in such jargon, right? That's like to be approved for a journal. And it's like, let's simplify it versus like, it's also evidence-based, made out by the scientific definition, if you have evidence of patients repeatedly having success with this, right? And I think the joke I say is that therapy is one field that actually, only now do we have the fMRIs and more science to back up what we've been practicing for so long, which is, I think, why it used to be this like woo-woo, oh, just talk about, your feelings and all this stuff. And now actually all the like exercises, things we can actually prove. And I go, see, so now we're proving it with the science tools that we had, but before we didn't really have those tools because it's not as, clear cut and dry. And so I think in our world, it's a little bit easier to grasp that, but in the science world, it's like they need that hard data. It's hard science for soft science. And I think you're coming around to this, hey, there's some soft science that proves the hard science.
Yeah, absolutely. And a lot of it is about the way you go about it too, and the experience someone has with it, and the practitioner and everything. Like, we can't measure, and that's another thing too, is looking at some of these studies is, or, you know, the modality or whatever, we can't, and so, like, with shockwave now, there's a huge issue, and that's, it's kind of the wild, wild west of, like, we're working with some of the top doctors across the world. Like, we go to these conferences, we're meeting with doctors and surgeons from Germany that are doing the stuff that, like, developed this stuff. They've been doing it for years before anyone else. And it's really cool to see, like, it's still so much in its, like, infancy phase. And there's still so much we're learning every 6 months when we go to these conferences. But anyone can just buy these devices, right? So people are getting, so this is another thing of, like, shockwave. So, like, our devices, I spent $100,000 on our two shockwave and EMTT devices, right? But I knew, like, it was all, like, 85% of the studies on shockwave were done on these devices. Yet someone can go online and buy a shockwave device on Amazon for $1,000. Is it the same thing? And then, what is that practitioner? How well are they trained on it? Do they have experience, or did they just buy it and started slamming people with it? Because I see online now a bunch of people getting this done, and the approach is being bastardized by the clinician. And it's like, well, fuck. Now, people are having a bad experience with shockwave. They have it once, and they say, oh, I had it, and that didn't work. It's like, did it not work, or was it not done right?
It's true in any field. And I think back to my oldest sister's a hairdresser, and she'd have to come fix people's hair who used box dye and be like, you know, there's actual, like, science, and we take chemistry, and we understand how this all works, and, like, your hair takes differently. And she would, like, be educating these people. And that's obviously not as detrimental to your health. But you look online, and now, like, you could get laser hair removal devices online that probably don't work like the big devices. And it's like, I think at the end of the day, it's also you get what you pay for. And so you can go that cheap route and try to DIY your healthcare, but that's something I'm not willing to DIY.
Yeah. I'm curious for you too, talking about the therapy thing. Do you think the use of, like, MRIs and fMRIs and all that is it that's gotten people to understand the importance of therapy and mental health now? Or is it just the sway of the generations and thinking and thought processes and just evolution of people and generations over time that's done?
Yeah, I think it's multimodal, right? There's no one answer. I think science people like science, so that influences them. I think in more things, it's more, I think COVID actually was a huge push for mental health, because people just, like, had to sit and deal with their shit and realize that, sorry, I hope we swear on this podcast, that's just the reality of, like, you know, you can't just avoid it anymore. You can't keep busy with work. So I think, and then the generation and normalizing it and all of that. So now, as you know, I think maybe we've swung a little too far the other way, and, you know, the generational thing, and that's a podcast for another time. But I think it's more so for sure, like, social society than the science. I think the science helps nerds like me go, see, it works, if done right, and you have the right practitioner and a million other ifs.
And I mean, we still have some more time here, so
okay.
We'll do another episode kind of all on this too, but I think this still pertains to this. So we're talking about mental health. And I've been working with you as a coach and therapist now for some time. And you do things quite differently. And one of the things that's interesting about you is you aren't fully bought into therapy the way it's traditionally done, or that it doesn't really work for everyone. And so part of us, like, and part of chronic pain, disease, all this is our mindset and stress and managing that. So it's a big part of it. So I want to hear from you, because everyone says, oh, just go to therapy and deal with this.
Yeah.
And for a lot of people, it doesn't necessarily work that way. Like, I went for a while and I learned some things, but for me, like, working with you has been much better, because there was accountability, there was an action plan, there was pieces of my life that just weren't structured well. Where when I would go to traditional therapy, it was like, okay, yeah, tell me how you feel about this, what happened, and then, like, sit with it. And it was like, I feel like I went to the doctors and they told me I was fat, but didn't give me any type of plan on what to do. And now I'm just sitting here going, great, I'm fat and I don't know what to do.
Yeah, no, you're spot on. There's a whole lot to say there. I would say, in summary, just like there's different specialties in like a medical field or doctors, right? There's also different specialties in therapy, of course. Like if you have a severe trauma, you have PTSD, you have, personality disorder, right? Those things, there are people that are specialty, and let's just be clear, like we're not talking about that here, okay? We're talking about general population, which is what's called counseling psychology. And what that means is you have life circumstances, you have things, you might have some of those little trauma things, or, I don't mean to dismiss them and call them little, but you might have some serious stuff that have happened in your life. But, you can function. You're a functioning member of society, right? You just have things that make your life harder. You get in your own way sometimes, et cetera, right? And those people, sitting with your feelings, and especially, let's take it a step further, I work with high performers. That is my specialty, right? So I work with people who are pretty much motivated, right? But they still get in their own way, right? And so what we're looking at here is that traditional therapy model, the research supports about a year of therapy per event, like major life event of talk therapy. Now that's if you have the right therapist, which is really about if you relate to them or not. That's if, depending on how severity of processing and how many of those types of events you had, right? But after that, let's say somebody dies and you're just processing the grieving process, someone close to you. After about a year, it's kind of like there's not much more to process. It's now, so what? It's okay that it still impacts you. I lost my dad, and 8 years later, it would still have a random moment of tears. And it's like, okay, I know why that came up for me, but I don't need to go process it. Like, obvious, duh, that sucks, move forward. And a lot of people don't practice that way because the therapy is about empathizing and validating. And that is important. But I get frustrated when there is no so what, or there's a time to not hold someone accountable. Maybe they come in and they have had a hard week and you're like, it's okay, like no big deal that you didn't do the homework or whatever. What's a more achievable goal for the next time, right? That's how I show empathy. But I'm not going to just dismiss that, well, you're not doing the work outside of these sessions, it's not going to happen, and that's where I kind of take a different approach. There's a lot to say here. Does that answer the question, or how far should I go?
You want to talk about how you call people out on their bullshit? I've only had one other therapist, but as an adult. But I think that's something you do very differently too. That's unique.
Yeah.
A lot of people, it's like, well, how do you feel? How does that make you think? What things could come of this? Where, like, you've called me out multiple times on different things of like, so yeah, I'm not feeling good, this and that, and you're like, you're fucking lonely. And I was like, oh, but it was really cool.
I don't think I said it just like that, but
you didn't have the F-bomb in there. You said it much more tactfully than that, but you downright said, like, you are lonely and you have symptoms of loneliness. Like, there's nothing wrong with you. It's just a matter of where you are in life, and you're single and these different things at the time, and like, it was very freeing for me to be like, oh, like there's a reason.
Yeah. Okay. I like that. Yeah. What you're getting at. So I will say I meet clients where they're at. So not every client gets called out if that's just not what they either, I don't even want to say can handle, but it's not going to land well with them. So it's not going to work. Right. I do try to approach clients based on what they receive and what I think will work best for them. Some people, it's a slightly different approach, but most of my clients are like you. And it's, you have to build trust before you call people out. And I think that's a thing. This is true whether you're a therapist or not, or a coach or not, right? If someone just comes in calling you out off the bat, you're kind of like, I don't really like that person. If they've built trust and they've shown that they can empathize with you and understand you, and then they do it tactfully, like you said. And it's a lot of the stuff I coach you guys in as leaders, right? Like some of it is, of course, there's certain things I can see that I can't explain from all my training and years of working with people. But there's some things that are simple. Like if you have someone that you think needs to be called out about something, try to walk them there yourself, like ask questions. And what I do is I usually say something like, now you're going to hear this in everything I do with you. So it sounds to me like this. Does this resonate with you? So I'm not saying, hey, Brett, you're fucking lonely. Although I would say that's you probably. I probably, and we could go back and check. I probably said something like, it sounds to me like these are symptoms of loneliness. And you're like, oh God, I'm lonely. And it's like, and because sometimes, and you've done this too, where I say, it sounds to me like this. And you're like, that ain't it. And that's the difference, is having people who know to say that back. And I think it's the same as you, knowing to advocate for yourself in the healthcare field, right? It's like, I say that on my first session, I try to remind people, sometimes I'm not right. I'm just trying to dig in the right place. And I have to poke a few places to determine if that's the place to dig. But it's up to you to say, like, that didn't really hurt. That didn't really hurt. Ooh, that one kind of hit a nerve. And it's really the same thing. And that's the part where, there's some intuitive things. Like sometimes, just like you probably have some of these natural abilities. There's certain stuff I can't really explain. Like I remember doing our mock sessions in grad school and people going like, damn, you're just like good at this. And I'm like, am I? Cool. So there's definitely some intuition there that is explainable or not. I don't know. But the therapy field, there's so many different things. And at the end of the day, it's really meeting your client where they're at and understanding, like, do you understand what this person can take? And I think that's the difference, is I can read people and go, this might land for them, this won't. I'm not saying I haven't missed the mark for sure, or made mistakes, but, and I think the other thing that in practice is you're really not supposed to disclose much about yourself, if at all. If you do, you have to make sure there's an intention to it, right? I disclose probably a little bit more to relate, because and I've gotten feedback from people, they're like, it makes you relatable and it makes me more willing to give you more information when I've heard something vulnerable about yourself. Now, I try to toe that line and make sure, and I do ask myself, I still follow through a lot of those therapeutic models, like, is this going to help the patient? What is the intention behind sharing this? And even if the intention is just to like make them a little more comfortable, or to relate, or to say like, I've been there too. I'm not just telling you from an evidence-based, hey, do this, other people works. Like sometimes they want to see someone they trust and respect who also has used this thing and it's worked. So I do try to find that balance and still make it clearly about them. Or like I tell a lot of my patients, if I go over on the 50-minute mark, I go, okay, now I'll talk about myself. You can ask questions. That's kind of my like golden rule of like, it's still about you. It's still about you. If you have questions and we go over, I'm happy to share and be a little more open and honest. But that approach, like I said, like I don't lose a lot of patients. They keep coming, and I try to arm them with tools that they will not need me as frequently. The goal is to always have me to check in, because shit's going to come up and you don't want to retell your story, but you don't need me all the time. Right? That's how a doctor should be too, right? It's like, hey, I know your backstory. I can help you out when I see you going down the wrong path. But there's a lot of errors in therapy. There's a lot of things that are great in therapy. And there's a lot of people that practice, like me. There's a lot of people out there that practice in their own way differently. That's equally as great. Right? There's a lot of thoughts there.
I'm thinking back to Shrinking now, and just like how many, like I would love to like sit with you and just watch that show and analyze the three therapists and like their different approaches, because I didn't really think of that much now until you say that, of like Harrison Ford, and there was like the old school by the book, like you don't do this, you don't do that, and then Jason Segel is like, no, I'm gonna break every rule there is. Yes.
Yep. And it's funny because I would like pause that show often, and whoever was nearby, I would be like, blah, 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 here's this. And I'm like, nobody else cares. Like, just stop, Lauren. Because I did enjoy that show for that reason. I say, like, I am him. Like, I'm like, screw this. And I will say, I'll give some credit to the sports psych background in that I have a counseling degree with a specialization in sports psych. Not all programs are like that. So I have that educational background and training, and did, the clinical stuff. But they also, sports psychology in general is, you are a weird counselor. You are input into it. You're going to do sessions in a equipment room. You're going to, like, they don't make space for you. So you kind of learn this weird approach and realize like you're out on the field with them. And there is still that moment of like, if they come up to you, it might be clear they work with you, but you don't just go up to them and make it clear that they've been seeing you in front of the whole team, right? And so you kind of learn these boundaries of like, who wants that, who doesn't? What do I have to ask them to know the line on the... And so you just get set up in this weird position where you start to practice outside the normal counseling. So I think that's where it gave me that edge of like, you're going to be, like someone said it in a lecture I went to, at a conference, and it was like, if you work in professional sports, you're going to be weird too. Like they have weird schedules. You're going to be weird too. And you're going to be the weird person in the room all the time until you're not. And I think that's kind of, people are so like afraid of therapists. Like, oh, they just like, they're judging and psychoanalyzing you all the time. It's like, we're people too. We're just observing and taking stuff in. And then anything that we observe to analyze is only to help you, Yeah.
I guess Ted Lasso makes a good piece on that too, of like the therapist coming in, like, what is this lady doing here? And then like eventually the whole team is using her.
I commend Ted Lasso so much for the way that they went about that, and the way that they practiced with her was actually, she's a clinical psychologist, but she still did some of that stuff, like okay, I'll get a beer with you. Okay, like I'm going to come sit and watch practice and I'm going to talk to the coaches. And they did a very good job about how that's integrated and showing how people are like skeeved out by it and like, ooh, what, but then some people are like, this is great, and some it takes a little more. And then especially Ted Lasso himself, 100% a good example, because the coaches, when you're in an experience like that, or like, let's say even at your little business, right? You're the leader in that world and everyone's like, oh, Lauren's here and that's his business coach, like be on your best behavior. I'm not saying they do that, but right. It's the same idea. Like people might think that like, oh, what if he tells her about me and this and that? And the coach in that instance is the opposite. They're the one, like Ted Lasso is like skeptical, like we don't need you. I can do it myself. And it's like, we're not saying you can't do it, but there's things that we can do that you can't. Don't you want as many resources for your team as possible?
Yeah.
If this was nutrition, you would have it. If this was strength conditioning, you would have it. What's the difference, right?
Mm-hmm. Yeah.
So.
Cool. Awesome. Well, we'll have to schedule our next one to do this in reverse and interview you.
We will.
Because, we want to talk about, what I want to talk about with you is people managing burnout, psychological and physical burnout symptoms, like monitoring and being aware of it, just general stress management for overall health, and just kind of we'll go more in depth on the therapy thing and what things could look like for someone when done a little bit different and why. So
yeah, I love it. Well, thanks, Brett. This was informative for me too, and I hope a lot of people get a lot of help from it.
Yeah, and Lauren, where can people find you and reach out to you if they want to from hearing this?
Yeah, I'm on Instagram primarily at The Balanced Business Method. That's where you'll find me.
Do you have a website these days?
I'm reworking it right now, so It will be up, and it will be thebalancedbusinessmethod.com.
Okay, cool. Thank you for coming on, and I hope everyone listening enjoyed.
"84% of you that listen to this podcast frequently do not hit the follow button. If you've enjoyed any of these episodes, could you do us a favor and hit the follow button, leave a rating, and maybe leave us a review? It helps this channel more than you know, and the bigger the channel gets, the bigger the guests get. If you'd like to know more about training in person or online with Brett's Gym, Architect Fitness, please follow us on social at ARKITECT Fitness on Instagram, or visit ARKITECTfitness.com. Or if you want to rehab with barbell therapy online or in person, check out @barbell.therapy or visit barbelltherapyandperformance.com. Thank you for taking the time to listen.